Welcome to Adapt NCLEX, and thank you to deciding to watch this video. You will never go wrong by doing practice questions. This will tell you how much you've retained so far. So let's practice questions for the NCLEX. Few questions to test your brain. First question, EKG, of course. Everybody ran away from it. But guess what? Very straightforward. Test-taking strategy. What do you do? What are you being asked? What is the correct interpretation? First thing, so you read from the back. My question is, I need to interpret it. Then read your case. The telemetry nurse saw the client cardiac rhythm strip shown below. So that's the case. She saw it. What's the buzzwords? Cardiac rhythm and correct interpretation. Correct interpretation. That means I need to interpret this. That's all. No matter what I do, I need to figure out what it is. Then you said, what do I need to do? Yeah, find the rhythm first and make sure the rate is whether it's in sinus rhythm or not. So you do RR interval. Just by looking at it, you can see that this is sinus. If this is sinus, it cannot be AFib, atrial fibrillation. Therefore, this is gone. Then I calculate my rate. My rate, you can't, they don't tell me whether this is 6 seconds, so I calculate the R, the distance between the two R. It look like 5. 1, 2, 3, 4, 5. It's almost 5. This is, you can see there's 1 here, you don't see it well, so 5. That means 300 over 5. And this is 60. So this heart rate is very slow. So it may be sinus brady. I look at P, and it's followed by QRS, P, QRS, P, QRS, P, QRS. I don't see something like that, multiple P's, like in the sawtoothed manner, right? Therefore, it can be a flatter, right? Then you check the distance between the P and the R. The PR interval is supposed to have, it should be less than 5 boxes. This is almost 10. From here to here is 5, 10. So 10 boxes. That means I have long PR interval. Long PR interval is not going to be sinus brady. It's not going to be sinus rhythm. Even though the rhythm in sinus is not specific, it has to be heart block. Question analysis and breakdown. Don't panic, take your time, analyze it, and take each answer choice and knock them down one by one. So, first degree heart block from a prolonged PR interval. Number 2, case study. A 3-year-old was seen in the emergency room for 3 days of diarrhea, buzzword number 1, and decreased PO intake, buzzword number 2. Something should tell you that a 3-year-old is having diarrhea, cannot eat, and know what will happen to the kid. Mother report 1 wet diaper, buzzwords number 3. For the past 3 days and feels sleepy. They usually don't do that. Number 4. Crying baby with no tears when you examine them. That's clue. They don't have tears, number. And lips are pale lips and skin texture is flat and capillary refill is greater than 3 seconds. These are all exams buzzword like number 5. Tachycardia, temperature is okay, blood pressure is okay. So what is the diagnosis? What's your action? And what you need to monitor? It does not take, it shouldn't not take you a while to figure out what this patient is having. Diarrhea, cannot eat, diaper is dry, can't sleep. Sleeping most of the time. His lips is pale. When you cry, there's no tears. and then you feel his capillary refill is greater than 3 seconds. That's hypovolemia, which is what? Dehydration is the diagnosis. But there's different kind of dehydration. There's three. There's a mild form, moderate, and severe form of the disease. Severe form, you have to see, you look into their eyes, and their eyes is sunken. Yeah, that's the way I look at it. This should be your clue. And their capillary refill is greater than 4 seconds. If I see these two buzzwords, that's all. You can give me so many information. This alone make me severe. Okay. The moderate, the mild, usually they have mild symptoms. You don't see sunken eye, you don't see capillary refill. So usually mild symptoms. And you have to work your way through with the moderate and mild. If I start seeing a lot of signs of dehydration, yeah, it's a moderate problem. If it's a mild, usually they don't have sunken eyes. The capillary refill is a little bit okay, close to 3 seconds. But if it's greater than 3 seconds, it has to be moderate. But that's how I distinguish it. So this patient is not mild, it's not severe. There's nothing in the case that tell you it's pyloric stenosis. So it has to be this. If it's mild, we let them drink. If it's moderate, we give them IV. If it's severe, we bolus them fast. So we don't need abdominal ultrasound. We don't need TPN either. Now, what would you monitor? Yeah, your capillary refill and see if it's coming down. Electrolyte is important, but the number of wet diapers, your urine output is the most important to tell you your fluid status. So people who are peeing, that means they are well hydrated. So that one is very important. We don't need a progesterone we're committing. So moderate IV hydration, capillary refill, and wet diapers for that question. Another question, read from the back. I like SATA. Which of the following statements need immediate intervention? And next, provide teaching to a client with constipation. Break it down. You're being asked to do something about what? Immediate intervention. Case somebody with constipation. Buzzword, constipation, followed by immediate intervention. That's all. I need to intermediate for somebody with chronic constipation. What would that immediate intervene? I will engage in moderate exercise 3 times a week. That's good. Activity is good. I will drink a moderate exercise is 30 minutes. That's all. I'll drink tea and caffeinated beverages daily. No, this will make you dehydrated. And dehydration causes constipation. So this is good, but we got to intervene in this. Eat food with high fiber diet. Good. This is good. Enema to stimulate my bowel. No, we want you to go regular. So either you use fiber or you go regular. No enema. I will not defer defecation. Yeah. What it means is if you feel like you get a poop, yeah, go poop. Otherwise, you develop worsening constipation. So this does not need. So this is 1 and 4. Once again, pick those answers you think you know. If there's only one answer choice you really want to intervene, intervene. If it's 2, intervene. But there's only 2 answer choices there that need to be intervened. Therefore, if you pick more than you need, you get it wrong. You lose points. Okay. Number 4. What do we have? Select or apply. The same thing, right? And then she's taking care of a client with dysphagia and being fed via NG tube. Which of the following action by the nurse need immediate intervention for intermittent bolus feed via the NG tube? A bunch of words, right? Read it backward again. SATA. So which of the following action by the nurse need immediate intervention for intermittent feed via the NG tube? You have a patient being fed through the NG tube and using bolus feeds. Which one would you intervene? When you're getting bolus feeds, there's certain things you can do. Bolus feeds, first, okay, you have to go through the stages. It's different from continuous feeding. Bolus feeding is considered as intermittent feed. So the first thing you do is you check the residue. Okay, so you check the patient residue before you feed them, and then place them in a semi-parallel position. Okay, flush the tube, bolus them with the feed, flush it again, and keep them upright for at least 30 minutes, sorry. So semi-parallel position. So once again, bolus feed, before you start, first, I will even check the tube placement to make sure the tube in the right place. Then check the residue. You don't throw it away and give it back to the patient. It depends on the amount. Then put them in the semi-parallel position, flush it, begin the feeds. After you finish, flush the tube, and then keep them 30 degrees, at least above 30 degrees, semi-parallel position after the feed. So which one needs immediate intervention? Assess for bowel sounds prior to feeding. Yeah, you're checking if they're tolerating their feed. So this does not need intervention. Check residue every 4 hours. This is a problem. Bolus feeds, you don't check residue. You check residue only when you are about to feed them. You don't do it. This is for intermittent feed. No, this is continuous feed. So continuous feeding, yeah, you check residue every 4 hours. But for intermittent feed, you only check it when you want to bolus them. Therefore, this needs intervention. Check for residue prior to feeding and discard the aspirate. This is partially right. You check the residue before you start feeding, but you don't discard the aspirate. It's a fluid. You need to give it back to the patient. Check tube marking at the nostril is the same as before. Yeah, you check in placement, so I don't need intervention. Ensure semi-parallel position before feed. Yes, I don't need intervention. Keep at flat after feed. No, you need to keep them in a semi-parallel position after feed. So the only one that you need intervention is 2, 3, and 6. You pick those so that you don't lose points and get 0 in that question. You can get 1 because there's 3 possible answers. But don't pick too much that you don't know. Select other plan. A nurse is taking care of a client who patient need kidney biopsy. Which of the following actions are appropriate? So for kidney biopsy, it's at your back. Okay. And then when we try to biopsy it, you lay on your face. So prone position. After we biopsy it, you need to be on supine to put pressure. So after procedure, pressure. There's certain things will avoid us from doing it if your PT INR is high because the kidney is vascular organ that will bleed. If you take any aspirin, spumidim, we're going to stop it, right? If you have uncontrolled hypertension, we will stop it. We will not do it. After the procedure, we look for signs of bleeding. That's all. So check CBC, make sure you're not anemic before. Check PT, INR, yes. Reschedule if blood pressure is 170 over 70 and did not respond with meds. Yeah, uncontrolled. Place the client in prone position after the procedure. After procedure, this is wrong. He has to be supine to prevent bleeding. Notify MD of a small bilateral frank ecchymosis after the procedure. Yes, frank ecchymosis, no matter how small they are, it's a sign of bleeding. So, and this is what we call gray tenor sign. It's a gray tenor sign. After liver biopsy, you should not see a frank ecchymosis. The patient is bleeding. Okay, so this is good. This is inappropriate. So this is the 6 quick questions you see cover broad of range, but just to test your knowledge. Once again, thank you for watching and all the best of luck. Good luck.